This is a client that I've started working with this past week with a lot of pain and cartilage loss behind his kneecap. So lots of pain around the kneecap with standing, walking, general day-to-day movements. And he had a big flare-up 2 weeks prior to seeing me after playing a lot of tennis, but has been dealing with knee issues on and off for a long time. You can see that there's a history of surgery in that left knee. But I wanted to show you the image that he sent me because, and you can see the swelling in his left knee. And I wanted to show you this image because it's an area where a lot of people will experience a lot of swelling just above that kneecap. And I wanted you to know that it's very, very common, because if people experience this and they see this, they become terrified to move the knee. They'll keep the knee stiff, and that will make things much, much worse. We have to start getting that knee moving and start to push that fluid out. And this is an area called your suprapatellar pouch, just above the kneecap. And very similar to the Baker cyst in the back of your knee, when the joint has become irritated behind the kneecap or between the shin bone and thigh bone, excess fluid will be dumped into this pouch. Now, as we work with each other, monitoring that swelling will be key over the first few weeks, where I'll have him check in with that knee every morning. Now, typically there'll be a loss of knee bend, trying to bring that heel towards his glute, towards his bum. That will be lost oftentimes. So we'll assess that and monitor that to guide things as we go forward. Because for the first 2 weeks here, we're getting him into a knee sleeve, a compression sleeve, and then getting some gentle, frequent but pain-free movement around that knee to begin pushing that fluid out, so we can start addressing the underlying problems where there's a lot of weakness around the muscles across that whole leg.